Welcome to our deep dive today. We're going to be talking about recognizing and responding to anaphylaxis.
Oh, very important stuff.
It is, and we've got a great chapter from a medical textbook. It even has 2 real-world case studies.
That's fantastic.
Yeah. So we'll really break down, what anaphylaxis is, why it's so dangerous,
All right.
and of course, what to do, how to act fast in an emergency.
Because it is an emergency.
Absolutely. To help us break down this very important topic, we've got our expert.
Happy to be here. I think these case studies are really powerful in understanding how this all unfolds.
Yeah.
Really, what's at stake?
Okay. So let's start with, I guess, the basics. Like, what exactly is going on in the body when someone goes into anaphylaxis?
So you can think of it almost like an allergic reaction on overdrive. It's not just like a runny nose or itchy eyes.
Yeah.
This is where your immune system is triggering a chain reaction.
Mm-hmm.
That can affect your whole body, and it can happen in minutes.
Wow.
So it's like your body's hitting the panic button, and it can be life-threatening.
Wow. That sounds terrifying. And I know in the textbook it was talking about, like, the airways constricting, blood vessels widening, blood pressure plummeting.
Right.
What is happening?
Yeah. So you can kind of think of it as your body going into this emergency mode.
Okay.
Your airways tighten up, which makes it hard to breathe, of course.
Right.
And then blood vessels widen, and that leads to that sudden drop in blood pressure.
Oh, okay.
So that can cause dizziness, weakness, even loss of consciousness.
Oh, wow.
It's like this cascade of events.
So it's not just about treating symptoms, it's about stopping this whole cascade.
Exactly. You got to hit the brakes on that runaway train.
Yeah. And I know that epinephrine, is that like the go-to treatment?
Yes, it is.
So can you explain why it's so crucial and how it works so fast?
So epinephrine, it's a powerful medication,
Yeah.
and it directly counteracts all of those changes that we just talked about.
Wow.
It opens up the airways.
Oh, okay.
It constricts those blood vessels. It helps stabilize blood pressure. So it's essentially reversing those life-threatening effects.
It's like an instant reset button?
Pretty much, yes.
Wow. Let's dive into our first case study and see how this all kind of plays out.
Okay.
The textbook introduces us to Brianna. She was a young woman who went to the dentist.
Yeah, routine appointment.
It seemed pretty routine at the time.
You would think.
She got a local anesthetic injection,
Right.
and that's when things took a turn.
That's when things went south.
The textbook talks about how she suddenly developed difficulty breathing, preatness in her chest, even some swelling of her tongue.
Yeah, so these are all classic signs of anaphylaxis starting to take hold.
Okay.
Her body was reacting to something in that injection, and it was escalating really rapidly.
Wow. It's like her body just went haywire. What were the immediate priorities when treating Brianna, and why?
So always the first priority in any anaphylactic situation is making sure that the person can breathe.
Yeah.
So they give her oxygen right away
Okay, that makes sense.
to support her lungs. They were struggling.
Yeah. Now, the textbook also talked about the importance of epinephrine.
Absolutely.
So they gave her that too.
Oh, for sure.
Yeah.
I mean, in a situation like that, every second counts.
Right.
Epinephrine is the fastest and most effective way to counteract that cascade.
Right. It's like you said before, hitting the brakes on that runaway train.
Exactly.
Did she respond well to the treatment?
Thankfully, yes. The textbook says after about 20 minutes, her breathing started to improve.
Oh, good.
And her blood pressure stabilized.
Oh, wow.
So really just a testament to how quickly epinephrine works.
That's a relief. But this makes me think, if epinephrine acts that fast, why not just give her more of the local anesthetic, the xylocaine, to counteract the reaction?
That's a really good question.
Yeah.
And it highlights why understanding how anaphylaxis works is so important.
Yeah.
Xylocaine, it numbs the nerves, but it does nothing to address the underlying immune response.
Right.
That's driving the anaphylaxis. So epinephrine is the only effective treatment in this situation.
So it's like trying to put out a fire with, I don't know, like a garden hose.
Right, exactly.
You need the right tool for the job.
You need the right tool.
Yeah.
Now, this brings us to our second case study,
Okay.
which shows how diverse these triggers can be and how anaphylaxis presents.
Yay.
So this case study is about Ralph.
Ralph, okay. And from what I remember, Ralph had a bit of a different story.
He did, yeah.
It wasn't a dentist appointment?
No, this all started with a fall
Okay.
from a ladder.
Oh,
Yeah.
very good.
And initially, it seemed like a straightforward case. You know, he fractured his wrist and his femur.
Oh, wow.
But then things took an unexpected turn.
I'm guessing the fall wasn't the only problem.
No, it was not. After they did their initial assessment, Ralph started having trouble breathing.
Oh, no.
He developed what we call stridor, which is kind of this high-pitched whistling sound when you breathe in.
Okay.
And he even started to show signs of hives.
Ooh, okay. So those are some familiar symptoms. Are we thinking anaphylaxis here too?
It certainly raised suspicions, and the textbook mentions this really crucial detail: the possibility of a wasp sting.
Oh, so maybe when he fell off the ladder, he disturbed a wasp nest or something?
Exactly. And, maybe that sting went unnoticed at first.
Oh, wow.
But then that could have been what triggered the anaphylactic reaction.
So two completely different scenarios, yet both potentially leading to the same life-threatening condition.
It is. And it just reinforces how important it is to be aware of it no matter what the situation is.
Yeah.
Even seemingly unrelated events can mask the true culprit.
I'm really curious to hear more about Ralph's case, especially how they managed his treatment because he was already dealing with these injuries from the fall.
Absolutely. There are some fascinating insights there, and we'll delve into that right after this.
Great. Okay, so we left off with Ralph, our ladder faller.
Yeah.
Who may or may not have gotten into it with a wasp.
Right.
So what happened next? Was his treatment as straightforward as Brianna's?
Not quite. You see, Ralph's case, it had this added challenge because unlike Brianna, Ralph had a history of coronary artery disease.
Oh, some heart problems.
Yeah.
Okay, that complicates things.
It does.
I bet that gave the medical team some pause when considering epinephrine.
Absolutely, yeah.
Yeah.
The textbook actually brings up this very question. Because epinephrine, while it's life-saving in anaphylaxis, it can also increase heart rate and blood pressure.
Right.
Which could be really dangerous for someone with a pre-existing heart condition.
So they're in a really tough spot.
Yeah.
Treat the anaphylaxis and risk, making his heart condition worse, or hold back and risk, well, something worse.
Right.
So what did they do?
Well, this is where medical judgment and a deep understanding of both conditions is so important.
Yeah.
In Ralph's case, the potential benefits of epinephrine, even with those risks, outweighed the potential consequences of not giving it to him.
So they went for it. Did it work? And more importantly, was Ralph okay?
They did, and thankfully, yeah, Ralph responded well.
Oh, good.
The epinephrine helped stabilize his condition, and they were able to carefully monitor his heart rate and blood pressure.
Wow.
The whole time. So it's a reminder that even in these really complex medical situations, there's often a path forward, but it requires, careful consideration and taking a little bit of a calculated risk.
That makes me think back to something we were talking about earlier with the xylocaine not working for anaphylaxis because it targets the nerves, not the immune system.
Right.
It seems like understanding how a medication works is just as critical as knowing what it's supposed to treat.
I couldn't agree more. And that actually brings us to a fundamental concept in healthcare, especially in emergency situations: the 6 rights of medication administration.
Oh, yes. The textbook touched on this, and it really struck me as, pretty simple but powerful framework for making sure everything is safe for the patient.
Absolutely. So the 6 rights are all about making sure the right medication is given to the right patient at the right dose at the right time.
Okay.
Via the right route with the right documentation.
It seems straightforward, but I can imagine, in the heat of the moment, with lives on the line, it's easy to miss something.
Oh, for sure.
So how do these 6 rights play out in a chaotic situation like anaphylaxis?
Well, that's where training and protocols are super important.
Yeah.
So let's think back to Brianna's case.
Okay.
The medical team, they had to confirm her identity, verify the correct medication and dosage for the epinephrine.
Yeah.
Administer it right away in the right way, and document everything.
Yeah.
Every step was crucial to her safety and the positive outcome.
And even with Ralph, where the decision was a bit more nuanced because of his heart, those 6 rights still guided everything.
Yeah.
They had to, weigh the risks, choose the appropriate dose, constantly monitor his response, and document everything.
Exactly.
Wow.
The 6 rights aren't just this checklist.
Yeah.
They're a framework for critical thinking and decision-making, especially when time is of the essence.
Right.
They help ensure that even under pressure, medical professionals can provide safe and effective care.
It's amazing how something so seemingly simple can have such a big impact on a patient.
For sure.
It highlights how in medicine, it's not just about knowing the science, but applying it correctly and safely in every situation.
You hit the nail on the head.
Yeah.
Understanding those mechanisms, recognizing those signs, and acting fast. with those right treatments are all crucial.
I think what's really resonated with me throughout this whole deep dive is just the idea that knowledge is power, especially with something like anaphylaxis.
I couldn't agree more.
Oh.
The more we understand about anaphylaxis, the better we are to identify it, respond appropriately, and potentially save lives.
And we've covered a lot of ground today, from like the cellular level to real-world application, but there's always more to explore. I think we've given our listeners a really good foundation for understanding this complex and potentially life-threatening condition.
I hope so. If there's one thing I want listeners to take away from this deep dive, it's don't underestimate the seriousness of allergies. They can manifest in really unexpected ways. Knowing the signs and acting quickly can make all the difference.
Absolutely. It's like having a secret weapon in your back pocket. You might not need it every day, but when you do, it could be a lifesaver.
Well said.
So where do we go from here? What are some of the big questions that still need answers when it comes to anaphylaxis? Yeah, that's a really good question, and it's one that researchers are,
Trying to figure out.
all over the world are trying to figure out. So think about it this way. We've been talking about how epinephrine is like hitting the brakes on a runaway train. But wouldn't it be amazing if we could like prevent the train from running away in the first place?
I mean, that's the ultimate goal, right? Not just treating it, but preventing it from even happening. And that means going deeper, understanding the immune system, why some people have these really severe allergies and others don't, and how can we retrain the immune system to tolerate those allergens.
So instead of just reacting to the problem, we're trying to get ahead of it.
Exactly, yeah. And there's a lot of really promising research out there looking at things like immunotherapy, which involves gradually exposing people to small amounts of the allergen to build up that tolerance. There's also research into new medications that could block the pathways that lead to anaphylaxis. So preventing that cascade before it even starts.
So it sounds like we're really on the cusp of some major breakthroughs in this field.
I think so. And as we continue to learn more about those mechanisms, I'm hopeful we'll be able to offer more targeted and effective treatments. And ultimately find ways to prevent it from impacting people's lives.
That's a great note to end on. A note of hope and a glimpse into the future.
A little bit of hope.
Yeah, but before we wrap up completely, I want to leave our listeners with something to think about. So we talked about how vasodilation and bronchoconstriction are, key players in anaphylaxis. Knowing what we know now, how could we use that knowledge to develop new treatments or even like preventative measures?
That is a fantastic question to consider. Maybe by understanding the specific molecules involved in those processes, we could develop drugs that, block them or even reverse them. Or maybe find ways to strengthen the body's natural defenses against those reactions. I mean, the possibilities are really endless, and I think continued research will lead to some really groundbreaking discoveries in the future.
Yeah, it's exciting to think about all the potential solutions out there.
It is.
Just waiting to be discovered. And it just shows how important, curiosity and critical thinking are.
Absolutely.
And being willing to challenge the status quo when it comes to medical advancements.
Couldn't agree more.
Well, a huge thank you to our expert for sharing all your knowledge and insights with us today.
Oh, it was my pleasure.
And to all our listeners, thank you for joining us on this deep dive into the world of allergies and anaphylaxis.
Yeah, thanks for listening.
Remember, knowledge is power, and being aware of those signs and symptoms and understanding the importance of a quick response could really make all the difference in an emergency.
It really could.
Stay curious, stay informed, and keep diving deep.